these decisions of firing various folks and boards just creates more chaos, more uncertainty in the system.
After Danielle Smith dismissed the entire Alberta Health Services governing board, replacing them with a single administrator, some are questioning the Premier's motivations. Associate Professor of Medical Law Lorian Hardcastle calls it politics.
This seems to me to be very election focused. The Premier wants to make short-term changes, and the Premier wants to scapegoat the AHS board in order to appeal to those members of her base.
Smith announced Thursday that newly appointed AHS Administrator Dr. John Cowell will be responsible for reducing wait times with EMS, emergency departments, and surgery all in the next 6 months. Hardcastle says that the timeline not only plays into the election, but also seasonal illness cycles.
6 months from now, we won't be going into respiratory virus season, but we'll be coming out of it. And so even without any changes to the system, we would see some improvements.
Chris Gallaway is the executive director with Friends of Medicare. He agrees that the reform timeline has some natural benefits for Smith.
This is about the fact there's an election coming up and there's not many months left in the mandate, and them wanting to look like they're setting a benchmark and then achieving it in time for an election.
In an open letter addressed to all Albertans, former AHS board member Tony Dagnone stated, "No healthcare provider in the Alberta Health Services organization should be subjected to the unfound blame and shame vocalized by the Alberta Premier." He later wrote, "Clearly the Premier has chosen to play her misguided followers who rant against science and academic medicine under the veiled guise of freedom." In Calgary, Tate Laycraft, City News.